I came across this case as I was preparing for a client provider call earlier this week. So the providers that I was speaking with were a women's health practice group. So they already consisted of OBGYNs and women's health NPs. So they were a little different from our traditional PCPs who use our platform. They're kind of specialists already. And they use Rubicon as a multi-specialty virtual platform already. So I was really looking for a case that highlighted that virtual specialty care use as it aligns with where our company is focused on. And so I thought this case specifically really encompasses that. I know this is a transcript of the actual case as it was submitted, and I know there's a lot of big words in here, so I won't go too much in depth, but I hope that you all learn a little bit of medical jargon here. So this case is of a 36-year-old female who is, it says here, G5P2022, which is a label that every single pregnant patient gets. So in clinical practice, the only way that you identify a pregnant patient is by this label. So G and P stands for gravidum and parity, which is the number of times someone's been pregnant, which in this case it's been 5. And parity and the 4 numbers following it indicates the first number is the number of live full-term births. So she's had 2. 0 is number of preterm births, and 2 is number of miscarriages and abortions, and the last 2 is number of live children that she currently has. So this is a currently pregnant patient who has a history of hepatitis and a family history of liver cancer and liver nodules. And she recently found out that she was pregnant, and she came to her primary care provider asking if this would be safe, if this pregnancy would be safe given her history of liver nodules. She's got 5 known liver nodules with unclear etiology, but they're most likely to be what's called focal nodular hyperplasia, which is a benign finding. The largest lesion is almost 7 centimeters in diameter, which has been growing in size. A recent CAT scan showed even more lesions scattered throughout the liver. And even though most of these lesions are consistent with this benign focal nodular hyperplasia, the patient has normal liver enzymes, a negative tumor marker, and the plan was for her to get an MRI in the next January. And so the PCP had submitted a consult saying that the plan was for her to follow up with hepatology and discuss with MFM, which is a maternal fetal medicine specialist. But local OBGYN and MFM offices have been difficult to schedule and access is limited. And so the PCP had asked, what are the considerations that the patient may want to think about in deciding whether to continue with her pregnancy? Given that our main concern is safety for the fetus and herself. Would it be recommended to get a liver biopsy and a definitive diagnosis before deciding? And would it be safe to get a biopsy while she's pregnant in the first trimester? If not, would imaging be recommended throughout pregnancy? Okay, Britt, next slide. So the PCP had originally sent this consult to an OBGYN MFM specialist. And so an OBGYN specialist already goes through 3 years of residency training. And to become an MFM specialist is an additional 3 years of fellowship. So we're super lucky to have a specialist like this on our platform to begin with. And many pregnant patients need an MFM specialist throughout their pregnancy. And so this specialist here responded essentially saying this FNH finding on her liver imaging is essentially a benign liver lesion, and said that in the context of pregnancy, that she would recommend avoiding a liver biopsy because the bleeding risks increase with advancing gestation. And especially because the patient is asymptomatic and her laboratory testing is negative, she would not want to proceed with a biopsy. And then she suggests discussing this case with hepatology, just to confirm. And so the PCP was able to turn around right in the platform and proceed to ask the same question to the hepatologist, which, to become a specialist in hepatology, you have to go through a 3-year residency in internal medicine, followed by a 3-year residency in gastroenterology, followed by another year fellowship in hepatology. So this is a super specialized physician who I'm also really lucky to have on our platform. So he had responded, does she have any other symptoms? Does she have any lower GI symptoms? Has she had a colonoscopy? And typically we don't biopsy for primary liver cancer, and the imaging characteristics to suggest FNH, which is a benign liver lesion, and that he's pretty confident that that's what's going on. And if in this setting, he would recommend getting an MRI, which would be safe in pregnancy. Next slide, Britt. So overall, pregnancy is complex and it often needs multi-specialty care. And I think everybody already knows that using this platform on Rubicon, primary care providers can reach multiple specialties, especially when in-person referrals are not possible, when you don't have a super specialized person like a hepatologist or an MFM nearby. And, and I just want to mention that all physicians, healthcare workers, NPs, PAs start their practice in clinical medicine by taking an oath called the Hippocratic Oath. And it's a code of ethics, essentially. And the first rule of this oath is to, 1, do no harm, and 2, to do what's best for your patient. And so I feel really lucky to be a part of Rubicon, where we have a safe platform for primary care providers to ask virtual questions to their specialists to get the best help for their patients, and for specialists to be able to offer their unbiased medical opinions, and the recommendations to do really what's best for their patient. And so I feel really honored to be a part of this group.